there's been very little buzz about getting a fourth dose of the COVID vaccine. Remember, with the first, the second, the third doses, most people were dashing out to get them as soon as their age group became eligible. That has not been the case with the fourth. So should you or shouldn't you get yours? Now, I wanted to speak to this particular expert because I recall from our previous conversations him being somewhat dubious about vaccination for children. And I wondered what he thought about the fourth booster shots now for adults. They're now available in Quebec, by the way, for everyone over the age of 18. That went into effect last week. Let's talk to Dr. SUMON CHAKRABARTI, who is an infectious diseases physician at Trillium Health Partners in Mississauga. Thank you for your time today, Doctor.
Great to be here.
So where do you stand? What are your feelings about the fourth dose of the COVID vaccine?
Yeah, this is a tough one as well. And I think part of it has to do with the fact that I'm not entirely clear what the benefit is and who would benefit the most from this. I think it's clear that, that we really had to get as many people vaccinated with the first two doses above 18, when we were in the emergency phase of the pandemic, which we are thankfully coming out of. But that said, with the boosters, it's clear the highest benefit came from the third shot, meaning people who were especially over the age of about 65 or 70 and people with significant immune compromising conditions. That was clear. People who were otherwise young and healthy, the benefit wasn't all that clear. And now talking about a fourth dose, we don't really have a lot of good high-quality evidence for who should get this. And I'm not saying that people shouldn't get this. I just think that now that we have time to think about it and we are months away from our winter season, it's important for us to get high-quality data from randomized control trials, see where the benefit lies, and focus those vaccinations on people who need it the most.
Can I ask you a really simple question just having to do with less contagion during the warmer months? Why is that? Why is the virus less happy, thriving less when it gets warmer out?
Yeah, there's a general theme with respiratory viruses, and I think that it's multifactorial. Part of the fact that most people are, much less inside actually than when you're outside. The essentially perfect ventilation there really reduces the risk of viral transmission. The viral dynamics change in warmer air. It's harder for the virus to travel in that area. And I think also just in general, even things like sunlight and UV light can make the conditions that when you put all of this together, viral transmission is lower. And this is something that we saw even before COVID. It's a very classic pattern with respiratory viruses in general.
Okay, and then let me ask you about immunity waning. That has nothing to do with the weather whatsoever. It has to do with how long it's been since our last dose or our exposure to the virus, Doctor?
That's exactly right, but we have to really be careful about what we say about immune waning. I think one of the things that's been lost in the discussion is that we've talked about immunity waning, but that generally will be in response to mild infection. So, for example, if you get exposed to the virus, say 3 or 4 months after you've had your most recent dose of vaccine, you can likely get infected again and get symptoms. But overwhelmingly, these symptoms are going to be mild, something like a cold or a mild flu that maybe keep you in bed for a day or two, but certainly won't hospitalize you. What we see is that long-term immunity against severe consequences, like getting really bad pneumonia, you need oxygen or a ventilator, that is very, very robust and does not wane as easily. We saw that we needed to bump up immunity for older people for protection against severe disease. But in general, if you're fully vaccinated with at least 2 doses and a third if you're higher risk or older, the protection against severe disease doesn't wane that easily. And that is really what we're focusing on.
Okay, we're speaking with Dr. SUMON CHAKRABARTI, who's an infectious disease physician in Mississauga. Who then should be considering getting the fourth booster?
So the fourth dose, I think, was important, for people, elderly individuals, especially those who are in long-term care, people who have profound immune suppression. So, for example, somebody who has leukemia or is on treatment for a blood cancer, a transplant patient. These are individuals that I think that in any situation are going to be at higher risk, and that's why this was given to them, even without the high-quality evidence. one thing that we have to remember, we saw with the fourth dose that its effects against protecting against mild infection waned even more quickly. It was something like 3 to 8 weeks. So something where we time it for the respiratory season may also be important. But again, we now have a couple of months where we can now gather high-quality evidence, which is happening around the world. And we really want that before we make a call on whether we give a broad amount of vaccine to the whole population.
Okay. And then, here in Montreal, they're saying as many as a third of us had COVID within the last, from December to actually 70% of 18 to 34-year-olds, I believe it was, or 39-year-olds had it between December and March. 1 in 4 Quebecers and 1 in 3 Montrealers. So huge numbers of people who have had COVID recently. Does that kind of act as a booster in itself, Dr. Chakrabarti?
Yeah. So thank you very much for that. That's a very, very important point I forgot to mention. Absolutely. We've had 2 huge Omicron waves in the last couple of months. And absolutely, people who have been exposed, we are now having lots of evidence from recently, but also accumulating over the past 2 years that shows that post-infection immunity is actually quite robust. And we saw a recent trial out of Canada. I think it came from Quebec or it was BC. Either way, what we saw is that people who have had 2 shots of vaccine plus COVID infection have just the same protection as 3 shots.
I saw that same study too, and I can't remember either. Because we're completely bombarded with numbers and information, and I mean, exactly. I think that's part of the issue, right? As we're trying to, we keep hearing, okay, do your own self-risk assessment, but the messaging has been very convoluted. So I guess the takeaway is, I mean, when in doubt, do you seek, a professional's opinion as to whether or not you should be getting a 4th dose?
I definitely think so. And I think that what we should look at is people, especially who are at the highest risk. And I know I sound like a broken record,
No.
But elderly individuals, especially over the age of 70 and institutionalized as well, people who have immune compromising conditions. And that to me is very different. It's not just that you have something like asthma. It's like you're on, anti-rejection drugs for transplant, blood cancers, this type of heavy-duty immune suppression.
Okay. And talk to us a little bit more about the variant, because I think that's also something that's coming into play with everybody. This initial vaccination was developed for the first strain of COVID, right? The Delta, I think it was. Was that even the first strain? I don't know anymore. But I feel like we've had so many variants since then. How effective is the vaccine at this point on the new variants?
It's a very good point. So the thing is, the original strain, the ancestral strain we call it, is what the vaccine still is. And we do see that it is still very good at protecting you against severe disease, even with a new variant. We're see varianting, as I sometimes call it, I verb it. It's actually a very normal part of viral propagation. And you'll see that this is going to happen many more times. And as time goes on, these variants tend to get more, oftentimes they tend to get more transmissible and immune evasive, very similar to the other coronaviruses that we see that cause the common cold. Now, it's not to say that it can never be more virulent, but it tends to not be with time, and that's certainly what we're seeing with Omicron. But I think that in the end, what's likely going to happen is all of us in the world will be infected by COVID and other respiratory viruses multiple times, but we do have robust immunity against severe disease. That might change a bit in the future where we need a updated booster, but as of right now, we're still seeing very robust protection against severe consequences from the vaccine.
Good. I'm glad to hear that. Okay, we're basically out of time, but just before I let you go, Doctor, with regards to another wave, we're hearing that there could be yet another huge wave. What are your thoughts on that?
My thoughts are that, look, respiratory viruses wave, and I think that we have to stop benchmarking it. We should understand that this will happen, especially in respiratory virus season. We now have excellent protection. We have therapeutics. And in general, the virus has become intrinsically less severe. So it's important for us, in my opinion, to move forward. I'm going to be dealing with this for the rest of my life, but the thankful thing is it's nowhere near as virulent as it was a year ago, and we can live with this safely.
Okay, that's pretty good. Let's end on that happy note. Thank you so much for your time.
You're very welcome. Take care.
Take care. You too.